This session is about transformation, and we're looking at two areas: children with disability and children with long-term health conditions. And as I'm sure all of you are aware, the proportion of children with these conditions is on the increase globally and in South Africa. And so this session is really about transforming ourselves as people caring for children, our services, and the health system in South Africa to identify children with disability and long-term health conditions, to incorporate them in our services, and to provide them with appropriate care. So to start off, I'm going to ask Tony Westwood to come and chat to us a bit about approaches to children with long-term health conditions.
Thank you very much. This is coming from Tony Westwood and colleagues. The colleagues aren't actually going to speak, but this was the first year in which I have taught on the postgraduate diploma for community and general pediatrics, a whole module on long-term health conditions and optimizing care. So I've learned a lot along the way, and my colleagues have also learned a lot. My students have learned a lot, I hope. And some of the things we talked about, I'm going to reflect in this conversation. So this is, in some ways, will be old hat to some people, but I'm hoping that there are enough of us here for this to be new hat to maybe change the way we think about children with disabilities and children with long-term health conditions. So my talk is really going to be quite high level around concepts that we need to think about when we are dealing with the reality of a patient with such a condition. So one of my first questions is there a difference between childhood disability, or child with a disability, and a child with a long-term health condition? What do those terms actually mean? And what I would say is that the answer is no, not really. So the International Classification of Functioning has been very helpful in this regard. It's at the top, you have the health condition. So if you can't walk, or you can't breathe very well, or you can actually do all those things as long as somebody gives you the necessary therapy or some kind of aid, that's the health condition that begins the cascade. And that's what we would call a condition. I mean, the term is used condition rather than disease, because if you take something like a genetic condition, it's not a disease. And if you've got a disease, it is a form of condition. And then you don't have to talk about disease, which often makes things sound worse than it is. So you take your health condition. It's a condition that affects your health, or can affect your health, or makes you need health services. But if you have the health services, maybe your health is fine, but you still need to come to the health services. And then there are potential effects. And those effects are mediated by what it's done to your body, what activities you may or may not be able to do, and what society does to you in terms of enabling you to participate. And there can be things about yourself and things about the environment that allow you to participate or be disabled or not be disabled in a particular environment. So disability at that point, under these definitions, is no longer a diagnosis or even a state. It is something that's remediable, that we need to do something about. The fundamental thing is that condition. Were you diagnosed? Are you disabled because somebody didn't make the right diagnosis, and so you're getting worse and worse because somebody thinks you've got cerebral palsy, but actually you've got a neurological condition. So your health condition is wrong, so your treatment is wrong, and you're not getting the right approach. So I prefer to use the term long-term health conditions, which you may be disabled or have a disability associated with that, or you may not, depending on how well we or you have done in terms of mitigating the bodily dysfunction. But what is long-term? And nobody actually knows, because the formative research hasn't been done. 20 years ago, 30 years ago, it was said if you were sick for more than 3 months, it was going to have an effect on you, and therefore that was the problem. But of course, you could be sick today, get diagnosed with an incurable condition, and you have a long-term condition. But why we need time is that some things get better, and if there's a certain amount of time that takes place, it starts to have secondary problems if you don't have treatment or if you're not managed well. So you can have secondary psychological problems. If it goes on and on, it's starting to affect your development or your growth in some way. So conventionally, it's taken to be likely to last for a year or has lasted a year, this particular condition. It doesn't mean it's lifelong. You could have asthma and you may grow out of it. But it's lasted for a year, so it's likely to have effects on your family, and we'll come to that in a moment. It requires both the family, the child, and ourselves to think differently. It's no longer about cure, in, out, off you go. It's more about, we might be able to cure you, but say it's a cancer, we could cure you, it may take 10, 15 years to do it, we could cure you, but in that time, the emphasis is actually on care. Not to say that if you've got a curable condition you won't get cared for, but the emphasis is now on care through the life course or through the duration of the illness to death or to cure. And the idea of the health is that you must in some way be interacting or needing to interact with the health system. So more than another child who's interacting in the ordinary way. So that's where this term comes from, and it's one that has been adopted in this country by the Committee on Mortality and Morbidity, and hopefully it'll become the way we talk in future, and we can have some debate about that. And with that, you get the wonderful situation in which you recognize that if you've got one of these conditions, the same kind of things generically are likely to happen to you regardless of the name of your disease. And that's known disorder, condition. Let me get it right. And that's what's known as the non-categorical approach. In other words, it doesn't matter whether it's genetic, acquired, got a specific name, or we don't even know what it's called yet, but we can see that you're not right. The non-categorical approach. So I'm going to unpack that now. And what the non-categorical approach says is the effects of the condition are more important than its name. It doesn't mean you don't need a specific medicine or a specific rehab, but it does mean that the effects on you are more important than the name of the condition. And it calls for a different response from the health system, which we'll come into a little bit later. So let's talk a little bit about the effects. So I went through with my students, and we came along across this set of effects that were done in a prospective, talking to families, looking at conditions, looking at health services, and thought these were the ways in which a long-term condition will or potentially can affect any young person and family, child and family who have a long-term health condition. So your neurodevelopment is automatically put at risk, potentially for almost everything, whether you can touch something or not, whether somebody treats you as a baby when you're actually grown up, all the disease affects your brain, or it affects your muscles, or you've got a heart condition, you can't walk as fast as somebody else, and you start missing out. And that obviously later on can affect your educational potential. The psyche, the way you think about yourselves, the way people think about you, the way you think about the world, the way you understand the world, the way you react to things can be affected both by the disease and by the environment. So that comes back to the disability question. Nutrition and growth may be put at risk, not in every condition, but in many conditions. And secondary disability is an important concept. Secondary disability means you have your primary condition, but because of what's happening to you, you may get a secondary disability. So if you have a very severe illness and you're treated in a certain way, you may get depression, or you're not treated in a certain way, you may get depression, which then affects your long-term illness, and so it goes on. You have greater healthcare needs. You're in and out of the system much more often than other people. You're thinking about it at home, or if you're not, your parents are thinking about it all the time. And there's an effect on social functioning, your place in society, your ability to get certain jobs, and the finances of the family. Mum gives up work because she needs to look after you, or she thinks she needs to, which she does, or she doesn't. But you start, and then you're going to and from, you're making more telephone calls than anybody else, and this starts to have impacts on the choices families make. And so we, as the health services, need to be aware that for all children with a long-term condition, every one of these things needs to be thought about in the way that we deal with this child and with this family. So what do children need? Well, as we said, as I haven't said, but I'm hoping it's implied by those of you who have any insight, that we're talking about a wide range of conditions, which I've just given some examples there of types and groups. So even if you've had your cancer cured, you're still being followed up into your adulthood by regular surveillance. So what those 7 items really constitute is comprehensive care. That is what we require. So all those elements, plus all the stuff that every other child gets, immunizations, growth monitoring, all those things is what comprehensive care encompasses, and our services need to respect that. And I've given some examples here of the kind of areas in which would be covered by comprehensive care. And I hope your area is in there, but if it isn't, then please tell me, or if it's not covered. But recognizing that all these areas, if we're looking after these children, all of these are all of our responsibility. Even if we're farming it out, and you can see why we need multidisciplinary teams, because the more complicated a condition is, the more we need many, many people to be dealing with these things. So quickly, some health service concepts. And they all begin with C, except the last one. So we've had comprehensiveness. So when we're thinking about the way we're looking after the child, have we set up a system to be comprehensive over the life course? Coordination. What's happening in the home, what's happening at primary level, maybe what's at regional level, what's happening with the social services, who's coordinating this child's care? This child has now got 5 different appointments on different days. Has anybody thought about it? Who's taking responsibility for that? Continuity. We know that if we're not seeing more or less the same people all the time, we are going to have poor continuity. If there isn't some way in which people know what's happening with this child, we're not going to go well. Are we communicating? Are we writing in the Road to Health book about what we did during an exacerbation of an asthma or change of treatment? Are we writing somewhere? Are we sending letters to each other? Are we communicating with the family? Does the family know what's going on? Are we doing the same thing in different provinces and the different places for the same condition, the same needs? Are we linking with the community, for example, the Down Syndrome Association? Are we making best use of society's resources to meet this child and family's needs? Are our people able to actually deal with this? Are we making sure the families are getting to those people? Are we capacitating the family to do it for themselves? That's the ideal. They tell us what to do rather than we tell them what to do. Compassionate, and we kept going through. And the last thing that I must stop now in 1 minute is the idea of integrated care. And this takes us out of our health system and says you have a society of children with a condition. Are we making sure that every aspect of their care, whether it's educational, social services, public awareness, and the health services, that we know what should happen for that particular group in a particular area? The UK is leading on this, and I'm very excited by what they're doing, producing platforms of care geographically for children with conditions. So this is not so much related to generic and more specific for the common conditions. So a whole system response. And the last thing I want to say is that at the end of this, we're going to be talking about how we can make generic approaches to dealing with long-term conditions and put them into the essential package of care that we're talking about. Basic health care for children with long-term health conditions. And that's the end of me. Thank you very much.